My name is Katie Scott. I'm from Bismarck, and I work at St. Alexius Hospital.
And what's your job title?
I'm a registered nurse.
And tell us about your education.
I went to school at the University of North Dakota, and they have a bachelorette program for nursing. So I did do the bachelor program there, which is a 4-year program. And then you get your BS, and that means you can just advance more because there are tech schools like at BSC where you can get your associate degree and still be a registered nurse. But if you don't have your bachelor's, then you can't move up to management, nurse practitioner, different things. So I did the bachelorette program.
What do you do in your job?
I'm a nurse. Let's see. I pass meds. I talk with doctors, speech therapy, physical therapy. Basically, try to coordinate all these different things we're trying to do for a patient. And you're kind of the go-to person. You see that patient for 12 hours a day. You help them eat if they need to, help them up to the bathroom. You kind of talk with family. You discuss what's going on. Like if someone came in with CHF, you would talk to them about diet and try to get them up moving in the hallways. Talk about what medications they're on. And then you're kind of their go-to person because doctors tend to come in and be really brief and use jargon. So then you'll go in there after that and kind of discuss in layman's terms what they're trying to say to that patient. And it's a lot of coordination between everything and especially there with the only thing that we really don't deal with is money in the hospital. I can't answer questions on insurance or anything like that, but we do have other people there. It's basically ADLs and cares and trying to get them to be better at home, like teaching them how to take care of this disease at home. So that's pretty much what I do.
How many hours do you normally work a week?
Most nurses, like all through the U.S., are starting to work 12-hour shifts. So we usually work 72 hours bi-weekly, so 3 12-hour shifts a week. And then depending on the hospital you get on, you can work just weekends or you can work just nights, overnights, because you have to have someone there all the time. So for me at St. A's, I work during the day and then probably 2 weeks out of the month I work nights. So it just kind of depends on the schedule and how busy the hospital is and how lucky you are to not get nights.
Do you take work home with you?
Sometimes. Sometimes it's hard when you get a patient that reminds you of home or reminds you of someone in your life at that time. Like one patient we had, she was only 38 years old and she had breast cancer and she'd had it for 8 years, and she was she was one of my patients for about 2 or 3 weeks, which is rare on the floor that I work on. So it was hard. She had kids and this awesome husband, and she ended up dying, and it was just sometimes you'll take it home with you, but unfortunately sometimes it's routine, and every person is different, and you should care about every person, but sometimes it gets so routine, you're so busy that it's easy to pass it off. Like I said, unless it reminds you of home, or it's a rare instance, or it's like a kid, or I don't think I could ever work with kids. I work with old people.
How would you describe the pace at which you work?
The pace on my floor, I work on a cardiac floor, so it's a lot faster than other medical floors or surgical floors. There's always something going on. We try to get our patients in and out really fast, so there's just so much with the coordination. You have to get a swallow study, and then you go work with physical therapy, and then you do all these tests, or you take them to OR, and I'd say it's really fast. You don't get to sit down a lot, which is good, because then you get to cut down on your gym time afterwards. But it is quick, so I think you have to really be motivated to do that kind of work, because if you're someone who gets overwhelmed easily or it takes a while to think through things, you could still be a nurse, definitely, just maybe in a different clinic setting or some other floor, but cardiac floor is usually pretty busy. And
how has your education prepared you for your career?
My education up at UND, they cover everything from rural hospitals to OB to intensive care. So they give you a little bit of everything during school, and then every nursing school has either a mentorship or a preceptorship, so you can kind of try to get 6 weeks of just something where you think you're going to want to do that. Excuse me. So some of my friends did 6 weeks on an OB floor, some did surgical floor, and I actually went down to Texas and did burns because I didn't think I'd ever see it again, and I thought it'd be something really intense, and it was. It was crazy. I'm just the things you see and the situations, and it was sad, but it was the people who do come through it. It was just amazing. So I think it helped prepare me for the fast-pacedness of my floor, and it helped me think on my feet, because in a critical care setting or intensive care, you really have to be quick, with your hands and thinking and what to do next, and you really have to know how to talk to people, because you need to tell your families, especially, if your patient's going to die, or talk with the doctor if your patient's not doing well. I think communication is the biggest thing, and we did try to do a lot of that at UND, and there's different tools you can use to communicate with different people, but I think it prepared me really well for nursing. They just showed you a little bit of everything. They do a lot of hands-on in nursing school, and I think any nursing school does hands-on and what you have to do. I think 200 hours throughout the program, and did a good job. I feel like I'm ready to rock.
What would be the starting wage for a job like yours?
In North Dakota, the starting job for an RN is about $21 an hour, and you can definitely, different parts of the country are much higher. It usually seems like down in Texas where I did my preceptorship, it was an inner city county hospital, so they'd start you out at $26 because it's not a very nice place to work. It's very hectic, it was just crazy. And California is huge now too. It's so busy. Their ERs, you can wait almost 23 hours to see a doctor, and they'll pay higher too. But here in North Dakota, it's very nice because we can get our patients in and they can see a doctor with that same day, and we just have the resources. So unfortunately, that means we don't get paid as much as out of state. But I think it's comparable to other professions in Bismarck. I'm not really sure, but I mean it's up to the standard of living, and it's good cushion, I think.
Why do you think you would give to a high schooler who thinks they might be interested in nursing?
If you are a high schooler and are interested in going to nursing, I'd say there's lots of different kind of schools out there for you to apply at. You can go to a tech school that's close to home. You can go to a big university in, Kansas if you wanted to. There's tons of places out there. I think you just have to you have to concentrate on school. There's a lot of prereq classes, so you want to try to get good grades in your chemistries and your biologies and apply right away. And if you don't get in the first time, you can always reapply the next semester. I think if you're interested and compassionate and passionate about working with people, just keep trying to get in and keep your goals.
Good job.
Yeah.